Welcome everyone and good morning this is the Colorado Health Institute's first ever virtual Hot Issues and Health Conference. My name is Romana Hasnain-Wynia and I am privileged to serve as the chair of the Colorado Health Institute, CHI. I also serve as the Chief Research Officer for Denver Health. In another first for this year, and there have been many firsts for 2020, we are offering live translation for this event. I'm going to turn things over to Jasmine of Community Language Cooperative for a brief explanation of how this will work. Jasmine?
Thank you so much, Romana. Hi, everyone. I'm going to go ahead and go through the instructions in Spanish and then I will repeat them in English. Hola a todos, mi nombre es Yasmín, estoy aquí de parte de la Cooperativa de Lenguaje Comunitaria junto con mi compañera Andrea. Vamos a estar proporcionando interpretación simultánea para ustedes para poder crear un espacio de justicia del lenguaje. Estos son espacios en donde podemos hablar en el idioma de nuestro corazón o el idioma que hablamos con nuestras familias. Para facilitar esto, les pedimos que por favor, cuando terminemos estas instrucciones, vayan a la parte inferior de su pantalla, busquen el globo que dice interpretación y pueden seleccionar ahí su idioma preferido en el que les gustaría escuchar la reunión. Si nos acompañan desde su celular, pueden encontrar interpretación bajo el menú de los 3 puntos que dice más. Les pedimos que por favor intenten hablar a buen paso, no tengan mucha prisa. Por favor, solamente una persona habla a la vez y si no están hablando, les pedimos que permanezcan en mudo en su micrófono. Si necesitan cualquier cosa, pueden hablarnos por el chat. So for the Community Language Cooperative, we try to create spaces where we can practice language justice. And this is spaces where we can speak the language of our hearts, usually the language that we speak with our families. And so as a part of the event today, we're going to be offering simultaneous interpretation. Myself, along with my colleague Andrea, are going to be providing this for you all. So after we finish this short intro, you're going to see a globe pop up at the bottom of your screen that says interpretation. We ask that everyone that is not fully bilingual, please do select your preferred language just to ensure that you hear and understand everything throughout the meeting. We ask that if you're joining through your cell phone, you find interpretation under the 3 dots that say more. And just to facilitate this, please be aware of your pace. Spanish is about 15% longer than English, so it takes longer to say things. Please only one person speak at a time. And if you are not speaking, just remember to keep your microphone on mute. If you have any trouble or questions, please feel free to reach out on the chat and we'll be happy to help. And we can go ahead and start interpretation now.
Wonderful. Thank you so much, Jasmine. Really appreciate it. We are really excited to be able to offer this as part of our efforts to make Hot Issues and CHI's work more accessible to more people. So I know that you all know this. This has been, a remarkable, different, heartbreaking, challenging, surprising, and also seemingly never-ending year. But we're sitting here almost in mid-December and 2021 is on the horizon and we're really hoping that we're going to be on a path to a better new normal. We've all had to pivot as individuals and as organizations, and CHI is really no exception. We thought we knew what the areas of health would dominate or what areas of health would dominate the conversation in 2020. Little did we know that our work would shift to assessing social distancing, school closings, telehealth, and other pandemic-driven issues. But the work continues, and I know that many of you have been attending Hot Issues in Health for many years now. And in fact, this is our 13th Hot Issues Conference. And we've evolved the event over the years. We've opened it up to new audiences. We're trying new formats. We're always trying to find the right mix of relevant, detailed health policy analysis and insights. But we're always doing this with what I consider a lot of fun. And that's what defines, I think, CHI, as well as this amazing health policy community. Truth be told, we thought about scrapping the plans for the event altogether this year, but between the global pandemic and a highly consequential election, we knew that it was right for us to have this conversation. So we're so appreciative that you're joining us. And I know it feels different. We miss seeing you, we miss seeing each other, but we really do want to thank you for being here in this virtual format. Before we actually get started, let me just offer some quick notes of recognition and thanks. I can't see all of you here today, as I already said, but I want you to know that you're being joined by over 500 others in this virtual conference room. And special acknowledgement needs to go out to our elected officials for joining us, including current and incoming state legislators, our county commissioners, our city council representatives, and so many others, our legislative and state agency staff, consumer advocates, hospital and insurance representatives, our community-based organization representatives, and so many more. I also need to thank my fellow CHI Board of Trustees and the amazing CHI staff. Their commitment, our commitment to health policy as a way of improving the quality of life for all Coloradans cannot be expressed in words. So let's get going. And with that, I'm really thrilled to introduce our fearless leader, CHI's President and CEO, Michele Lueck. Michele is celebrating her 10th year anniversary at the helm of CHI, and she has led the organization through rapid and significant growth and change and expansion. She's done this while keeping CHI's mission at the center of our work. It's always focused on the well-being of all Coloradans and quality of life for everyone. So with that, please join me in welcoming Michele Lueck.
Thank you, Romana, and good morning, Colorado. What a difference a year makes. Remember back to this time last year, on this very stage, well, you get what I mean, I left you with words of joy. We left thinking about how our work, your work and mine, mattered. Remember the metaphor of Martin Mullen? Remember the metaphor of Martin Mullen and the ultimate marble machine? We were each doing our part to fill the sounds of a symphony, each playing our own instrument to harmonize our health system. And in doing so, we sometimes created joy. We experience this joy when we get things right. The comments that you sent to me last year were not about the more nuanced or brainiac parts of my presentation. They were about this reminder to remember there's joy in what we do. And no sooner than I left this stage and we left hot issues than 2020 happened. Fast forward to this year. We meet again in a new and transformed format. Today, we have a whole new vocabulary. COVID-19 and the coronavirus are maybe the obvious ones, but now I'm pretty handy with words like R naught and positivity rate and telemedicine and PPE. What's on your list? I invite you to do me a favor and add your words, your vocabulary words to the chat right now. Go ahead and add your new vocabulary words to the chat right now. We also have a new awareness as the headlines force us to respond to the systemic racism that we are finally acknowledging is a pressing and public health crisis. We are living with the new realities of a fragile economy where the difference between the haves and have-nots, I fear, has only grown. We are also living with a very, very long election behind us. We've lived through this, and you'll hear from my colleagues, Allie and Joe, a little bit later in this program. We also have new skills. I have Zoom and, well, more Zoom, and I thank you for joining me here today. So we went from all of these ideas of joy to all of this in 2020. Today, I think we can reasonably say that we are well past the halfway mark of the pandemic. Vaccines are not only on the horizon, they are in unmarked trucks making their way to Colorado. It's a growing bright light at the end of a very long road. But I fear that given today's headlines of a record death tolls, over 3,000 people died yesterday alone, and the holidays right around the corner, we have a dark and lonely winter ahead of us. If there's one thing that you take from my remarks this morning, it's this: take good care of yourself, your family, and your community. We are not out of the woods yet. One thing that I love about my job at CHI is that I'm sometimes asked to look up, to take notice of our horizon and see what's out there. Call it sense making or vision, whatever it is called. It is the part of my job, one of the parts of my job that I love the most. Years like this one, though, it's really hard to do. We are living in what feels like day-to-day chaos. Crises can easily distract us in the moment, and the repetitiveness of our lives leads to procrastination or ennui. At least it does in this home office. But I thought I would take a moment to do just that, because I think we all need to focus our gaze up and out. And here's the second thing I'd like you to remember from my remarks today. If we approach our post-pandemic world intentionally and ethically, we can emerge into a world that's better. We call this the new normal in a new report from CHI. It's based on interviews with a handful of Colorado leaders, including some of you who have joined us here today. You can find a link to that in our chat. I can't do everything that this report does, but I want to focus on 3 lessons of leadership that I hope that you carry forward into the new year. The first lesson is this: it's the syndemic, stupid. We are not solving for a pandemic. We are solving for a syndemic. I owe a debt of gratitude to Dr. Hasnain-Wynia, friend of CHI and director of the Center for Bioethics and Humanities at CU Anschutz, for bringing syndemic into my working vocabulary. The definition is albeit simplified is this: a syndemic is a set of linked health problems that contribute to excess burden of disease. Syndemics occur when health-related problems cluster by person, by place, or by time. If that doesn't define 2020, I don't know what does. When I think of our syndemic, I think of the layering of COVID-19 and the ensuing health crisis. I think of the economic shutdowns and the very slow financial recovery we are experiencing. I think of the murders of George Floyd and Breonna Taylor and our ensuing social strife. Alone, each of these poses significant social, economic, political, and cultural barriers. Together, they can feel overwhelming. My assessment is this: the COVID vaccine is only the beginning of our recovery. Economic relief through stimulus packages, admirably taken on just last week by our Colorado State Legislature and also needed at the federal level, are essential. But so too are social and cultural reforms, from criminal justice overhauls to addressing the mental health crisis that has only been accelerated by this syndemic. Years from now, I think we will look back and see that the vaccine was the easiest part of our recovery from 2020. Lesson number 2: without our active intervention, inequities will only accelerate. Louise Westfall, another friend of CHI and senior pastor of Central Presbyterian Church, shared this quote in one of our interviews: "The pandemic does not define us. The pandemic reveals us." Think about that for just a minute. The pandemic reveals us. The pandemic of 2020 has revealed systemic inequities across all of society. True, they all existed pre-pandemic, but they have been quite frankly laid bare by this year's events. We know that far from being the great equalizer, COVID has hit communities of color far harder than wealthier white ones. I have spent considerable time thinking about this in our schools, from early childhood to higher ed. Just one example that stopped me in my tracks: our children are falling behind in skill development, and students of color are disproportionately impacted. McKinsey projects that all students will fall behind if school is online through 2020. Black and Hispanic students will be hurt the most. Low-income kids, they'll lose more than twice as much as wealthier white ones. My assessment is this: there is no better time than today to take the concepts of health equity out of the theoretical and into practice. I know this is easier said than done, but for years we have been immersed in conversations about health equity, and it's time to shift from the talking to the doing. Where to begin? I point to some bright spots here in Colorado. The efforts of the Metro Denver Partnership for Health on identifying and reaching priority populations is a great place to start. So too are Gary Community Investments' efforts to reopen childcare facilities across the region. But let's put equity into practice personally. Here's a real way. I learned this week from the New York Times that I am exactly 268.7 millionth in line for the vaccine. Nearly 270 million Americans deserve to go before me. Health workers, essential workers, teachers, even my college-age kids get to go before me. Let's make sure that I stay in that position. Let's not let wealth, political power, or white privilege change the ethical framework of vaccine distribution that's been developed by advisory committees to the CDC and the National Academy of Science. That will be hard choices at the personal level for you and me. Third, my third lesson to think about is let's demand a public health moonshot. Another way that we've been revealed is the strengths and weaknesses of our health and public health systems. There will be much scrutiny applied to what exactly went wrong in America in our response to this pandemic. That scrutiny has already begun. I point you to Fareed Zakaria's new work, 10 Lessons for a Post-Pandemic World. I credit him for some of my reflections here today. Along with scrutiny will come opportunity, and we, this policy community, should be at the ready to capitalize on this opportunity when it knocks. Here are 3 ways to frame our thinking. First, we need to overhaul and rethink public health infrastructure, not just invest more in what we have. We need wholesale reconceptualization. Zakaria points out that the tools we have had to fight this pandemic, hand washing, physical distancing, and mask wearing, are precisely the same tools that we had 100 years ago when we fought the pandemic of 1918. The one new tool in our arsenal, it is community testing, or testing overall. And it's safe to say that we have not gotten that exactly right. From where I sit, this deserves further thought. One opportunity to reconceptualize leads me to our second point, and that is that we need to harmonize technology. The know-how that has been championed in other sectors can effectively work in public health, but we need to imagine their application to public health and fund it. If Amazon can not only suggest my next book, but persuade me to buy it, How come we have not figured out how to persuade more Coloradans to stay at home? If we know that Thanksgiving air travel went up by 40% compared to earlier months, how come we're not using predictive modeling to know exactly how horrible an idea that was? I don't have the answers to these questions, but we need to really consider and implement them for the next pandemic or natural disaster or emergency we can't even yet conceptualize. We need to act now. Third, integration and alignment. This can take on many different forms, but I too think it needs to be overhauled. Public-private partnerships, especially in technology that I mentioned earlier, need to be considered. I think that Governor Polis and the innovation response team he put together early in this pandemic was a laudable idea. The intent was all there, but the realities of the crisis and the pressing time constraints prevented this idea from fully taking off. Public health and healthcare delivery, the connections between these two seemingly siloed systems just seem harder than it needs to be. And finally, we need to rethink the relationship between state and local control and action, particularly in public health. Governance has stymied concerted evidence-based action, and the efforts of the past 9 months are marked more by misses in communication, coordination, and enforcement than in the hits. So I leave you today at the end of 2020 with a different hope, not the joy of music or the ultimate marble machine. Instead, it is the hope that we will emerge better and stronger for all of this, for all we have been through in 2020. But we need your vision, your pragmatism, and your ethical leadership. As you think about how we reemerge, I ask you this: what has the pandemic revealed to you? I invite you to share your responses along with a selfie with us on Twitter or email us at the address you see listed here. Be well, Colorado. Imagine our new better and take your first step. Welcome to Hot Issues in Health 2020. And with that, I thank you and welcome you. I welcome now my colleagues, Allie Morgan and Joe Hannell, to our virtual stage to share with you what you are really waiting for, CHI's legislative preview.